If you ever wondered whether erectile dysfunction means something else is going wrong in your body, you're not overthinking it. That question makes sense. Most men don't ask it lightly, they ask it quietly, usually after a few moments that didn't go as planned. And what makes it harder is that the answers online are extreme. Either it's nothing, don't worry about it, or this could be serious. Neither of those actually help. This video is about how to think about that question properly, without fear and without brushing it off. Most men don't spend much time worrying about their health. They deal with things as they come. They keep moving. So when the erectile dysfunction shows up, it hits differently because it's not just inconvenience, it feels personal and it's hard to ignore. Men often tell me, I feel fine otherwise. I don't have pain. I'm functioning. So the question becomes, if everything else seems okay, why is this happening? So we are not talking about diagnosing you, and it's not for convincing you that something is wrong. It's about understanding what erectile dysfunction can be and what it often isn't, so you don't jump to wrong conclusion. Here's the part most men don't get enough credit for. Asking whether erectile dysfunction could be a sign of something else isn't anxious, it's intelligent, because erections don't exist in isolation. They depend on blood flow, on your nerves, hormones, energy, recovery. So it's reasonable to wonder whether a change there means a change somewhere else. The problem isn't the question, it's how most answers are framed. Some people dismiss it too quickly. They say things like, it's just a stress, or it's all in your head. That feels minimizing. Others jump straight to the worst case scenarios. Heart disease, damage, decline. That creates fear before understanding. Most men land in somewhere in between, unsure, alert, watching closely. And that's actually the right place to be. ED is a signal, not a verdict. A signal doesn't tell you what's wrong. It just tells you where to pay attention. Sometimes that attention belongs in the body. Sometimes in your nervous system, sometimes in lifestyle or load, and sometimes it's simply a misunderstanding of what erectile dysfunction actually means. Before you think this is something serious or convince yourself it's nothing, you need orientation. That's where clarity matters more than reassurance. If you want a calm way to orient yourself before jumping to conclusions, the ultimate vitality check below helps you identify which system is most involved for you right now. Not to label you, to stop guessing. Because the real risk isn't that erectile dysfunction is a sign of something else, it's that men misread the signal and respond in ways that create more stress than insight. And that's what we need to unpack next. Here's where this gets clear. Erectile dysfunction can be a signal from the body, but that doesn't mean it's a warning siren. Most signals aren't emergency, they are adjustments. Your body is constantly reallocating resources. Blood flow, energy, attention, erections depend on all of that lining up smoothly. So when erections change, it doesn't automatically mean something's wrong. It means something has shifted. Sometimes that shift is physical, circulation adapting over time, hormonal rhythms changing, recovery not keeping up with demand. That's real, but far more often, that signal isn't about damage. It's about load. Here's the part most of us miss. The body speaks in whispers before it shouts, long before pain shows up, long before tests looked abnormal, long before anything is wrong. Erections are sensitive to that whispering. They are not protected system, they are responsive ones. So if your sleep has been off for months, if the stress has been constant, if the nervous system hasn't been properly calmed down, erections often reflect that first. Not because something is broken, because something is being managed. This is where men misinterpret the signal and they assume if it is physical, it must be serious. If it is serious, it must be permanent. That leap is what causes panic. But the signal doesn't tell you what the issue is, it tells you where to look. And erectile dysfunction doesn't point to a single organ. It points to integration, blood flow, nervous system, hormones, energy, context. This is why men often say, I don't feel sick. I feel fine otherwise. I just don't feel like myself in this one area. That's not denial. That's accuracy. Here's where I put my medicine hat just briefly. Yes, erectile dysfunction can be associated with medical conditions. Yes, it can be worth checking in some cases. But most men watching this aren't ignoring symptoms. They are noticing a change and trying to understand it. And understanding always comes before action. That's why panic doesn't help and dismissal doesn't help either. What helps is proportion, seeing erectile dysfunction as a message without turning it into a threat. If you want a structured way to understand how different systems interact, body, nervous system, lifestyle, the free Heart Truth Masterclass walk you through this clearly. No scare tactic, just context. Because the mistake isn't noticing the signal, the mistake is reacting to it before you understand what it's actually saying. And that's where men tend to get stuck. Here's where most men drift off course. Not because they ignore erectile dysfunction, but because they overinterpret it. They feel a change and immediately try to decide what it means. Is it serious? Is it permanent? Is it decline? That jump happens fast. And once it happens, everything starts getting filtered through fear or dismissal. Some men panic. They assume the worst and start monitoring every sensation, every fluctuation. Others do the opposite. They minimize it, brush it off, tell themselves it's nothing. Both reactions miss the point because erectile dysfunction isn't asking you to diagnose yourself. It's asking you to understand the system you are in. Most of us never been taught what erectile dysfunction actually is. We are reacting to a vague idea of ED, picking up some ads, jokes, and worst case scenarios. So when something changes, we don't have a stable reference point. That's the real problem, not the signal itself, the lack of context around it. This is why men either chase reassurance or avoid the topic altogether instead of orienting themselves properly. And that's where things quietly get worse, not because the body is failing, but because the story around it becomes heavier, more rigid, more threatening than it needs to be. Before you ask, is this serious? Is this permanent? Is this something else going wrong? You need a clean definition of what erectile dysfunction actually is. Not the scary version, not the minimized version, the real one. That's why you need to watch this video where I explain what erectile dysfunction actually is and what it isn't. Because once you have that foundation, this question starts to settle. You stop treating ED like a verdict and you start seeing it as information. And when that meaning settles in, everything that follows becomes clearer. Not easier, clearer. I'll see you there.